Lord Collins, just to say that we are now live on Facebook and can begin when you're ready.
Welcome everyone to today's webinar. I'm Ray Collins. I'm Shadow Minister for DFID and the FCO. This is prior to the government's announcement, so nothing to do with that. I'm very pleased to be able to chairing this event at this critical time. I'm also chair of the APPG for Nutrition for Growth, which was established to focus and raise awareness for the December summit, which unfortunately again has had to be postponed. But the report that we're going to be discussing was of course written before the COVID pandemic, and therefore some of the issues in it may be considered not as quite as relevant. But I think today's panelists are going to tell you exactly why it's relevant and why we need to address this issue, particularly in the light of the pandemic. Now, before we formally start, I've just got a few housekeeping issues. Firstly, if you wish to raise a question, please use the Q&A box and be sure to include your name, organization, and the speaker your question is directed at, if it's not a general question. And 2, please share your comments and reflections in the chat box. And 3, speakers, can I ask you to keep yourself on mute until invited to speak, and then unmute before speaking. And finally, this event is being live streamed and will be broadcast via the GNR's Facebook page. So we are limited with time. It's quite a tight timetable, and I'm going to be posing the questions to the panel, and we'll be trying to move on. One of our guest speakers is going to be slightly delayed, and that's the Minister, Wendy Morton. But I'll say more of that as we go through the timetable. Our first speaker is Dr. Renata Misha, who will be addressing the report and focusing primarily on obesity and overweight. And I'll ask Dr. Renata to start and give a brief introduction about herself first.
Hi, and thank you everyone for joining us, and thank you for the introduction. I am Renata Mija, one of the 2 co-chairs of the Independent Expert Group of the Global Nutrition Report. It is with great pleasure that I will be presenting you the 2020 Global Nutrition Report. This year's report highlights action on equity to end malnutrition. Before I take you through the key findings of this year's report, I wish to give everyone a brief overview of what the GNR is about. The GNR was conceived following the first Nutrition for Growth Summit in 2013 to track stakeholder commitments and inspire action. Today, it represents the world's leading independent assessment of the state of global nutrition. We provide the best available data, in-depth analysis, and expert opinion rooted in evidence to help drive action on nutrition where it is urgently needed. One of the key functions of the GNR is to track progress against the global nutrition targets and the commitments made by stakeholders worldwide to reach them. Given this important mandate, the GNR has a central role to play in leading and coordinating a much-needed strengthened nutrition accountability framework. This would be in partnership with other key existing accountability mechanisms to hold governments, businesses, civil society, and philanthropic organizations accountable. Strengthening global nutrition accountability is essential if we wish to inform priority setting, ensure the appropriate actions are being taken, and tackle immense nutrition-related health, economic, and environmental burdens. And now back to the 2020 report. This year's GNR focuses on the need to tackle malnutrition through action on equity. Why action on equity? Because we will never end malnutrition unless everyone is treated fairly and according to need. Although the 2020 GNR was written before the COVID-19 pandemic, the key messages that come out of the report have a heightened significance. COVID-19 does not treat us equally. On one hand, undernourished people have weaker immune systems that may put them at greater risk. At the same time, poor metabolic health, including obesity and diabetes, has been strongly linked to worse COVID-19 outcomes. Focusing on nutritional well-being for all should be key. COVID-19 exposes a vulnerability of our food systems. People who already suffer as a consequence of inequities are particularly affected by the impact of containment measures. We must ensure there is enough healthy food distributed fairly to cover basic nutrition needs, especially for the most vulnerable. COVID-19 exposes deadly healthcare disparities. Even the strongest health systems are struggling with high healthcare costs and a shortage of personnel, equipment, and facilities. We need to fully integrate nutrition into our health systems to save lives and reduce healthcare spending while ensuring that no one is left behind. The way forward is through strengthened coordination, financing, and accountability. We need preventive public health strategies that pay attention to food and nutrition. We must turn the challenges into opportunities to accelerate actions needed to end malnutrition. Inequity is our defining challenge in ending malnutrition in all its forms. Most people cannot access or afford a healthy diet or quality nutrition care. This access is hindered by unjust systems and processes, holding people back from healthy diets and lives. Unfairness, injustice, and social exclusion are determined by social factors, such as wealth, sociocultural perception of age, gender, and ethnicity, that in turn impact everyday living conditions. These social determinants are the root causes of nutrition inequity that can lead to unequal nutrition outcomes. For example, poorer people may not be able to afford healthy food, or such options may not even be readily available in their communities, leading to worse nutrition outcomes. This in turn can lead to more inequity, as a sickened person may be less able to work, perpetuating a vicious cycle. The consequences of nutrition inequity are evident. We live in a world where 1 in 9 people are hungry or undernourished, and 1 in 3 people are overweight or obese. Let's now have a look at the state of nutrition in the UK. Diets are suboptimal everywhere, including the UK. Here we see how current intake levels in 5 key foods and nutrients compare to optimal levels of consumption, that is, levels associated with minimum disease risk, globally, in Europe and the UK. The middle line shows the optimal level. For fruits, for example, the optimal consumption is 250 grams per day. If intake, denoted by the colored circle, lies to the left of the middle line, then it is suboptimal for protective diet factors, such as for fruits. If it lies to the right of the middle line, then it is suboptimal for harmful diet factors, such as for sodium. People are not eating enough healthy food and are eating too much of unhealthy food. In the UK, adults consume on average less than 3 servings of fruits and vegetables per day, half of the recommended 5 a day. Diets of most children and adolescents also remain poor, with tremendous consequences for metabolic diseases and other diet-related illness later in life, given childhood is a critical period to establish lifelong eating habits. Achieving healthy dietary changes to improve our health is an urgent priority. Poor diet is the #1 cause of poor health and death worldwide, with similar patterns seen in nearly all parts of the world. Burdens attributable to poor diet exceed the burdens attributable to many other major global health challenges and traditional risk factors, such as systolic blood pressure and blood cholesterol. For decades, health systems and clinicians have focused on the medical, drug treatment-based model of disease that ignores fundamental causes such as diet and lifestyle. The consequences of this narrow approach are evident: the global nutrition crisis that is now sweeping the world. Perhaps the most pressing nutrition challenge around the world is the accelerating rate of diet-related chronic diseases, including obesity, which is a disease itself and a major risk factor for other diseases, such as diabetes, cardiovascular disease, and some cancers. Overweight and obesity are on the rise, and no country worldwide is spared. Looking at the UK, 1 in 3 children and 2 in 3 adults are overweight or obese. UK's progress in tackling overweight and obesity has been slow. Compared to Europe, the UK is a bit behind. Reversing the obesity epidemic a diet-related disease, would lessen the burden on our healthcare systems, as obesity is not only one of the costliest health conditions, but also a major risk of COVID-19 hospitalizations and complications. In the UK, the overall cost of obesity to wider society is estimated at £27 billion per year and is projected to reach almost £50 billion by 2050. Nutrition equity is our defining opportunity to fix the global nutrition crisis. Everyone deserves and should have access to healthy, affordable food and quality nutrition care, which is not simply a matter of personal choices. Governments, businesses, and civil society are accountable for healthier and more equitable food and health systems and must step up efforts. We need to remove systematic barriers and create opportunities for everyone to achieve healthy diets and healthy lives through pro-equity nutrition actions. Healthy, sustainable food should be the most accessible, affordable, and desirable choice for all. Nutrition care, preventive and curative, should be made universally available within our health systems. Now is the time to act in coordination and make nutrition central to any emergency or long-term response. So how can we make our health systems and food systems more equitable? The 2020 GNR covers both, but the present presentation focuses on health systems from a global perspective. Leadership and governance form the core of a strong health system and are critical to addressing nutrition inequities through strengthened policy frameworks, oversight, and accountability. Looking at the inclusion of actions related to global nutrition targets in health sector plans by country income, we see that the focus of lower income country plans is mainly on countering undernutrition, especially through promoting exclusive breastfeeding and reducing anemia and stunting. In contrast, high income countries focus more on overweight, obesity, and diabetes. It is important for lower income countries to not overlook diet-related chronic diseases. Higher income countries should also recognize the persistence of anemia and low birth weight still experienced in vulnerable populations. The low level of attention paid to breastfeeding in high-income countries is concerning, given its role as a double-duty action. Countries need to ensure that their policy instruments are fit to tackle both sides of malnutrition, particularly when these coexist. As we saw, poor diet is the leading cause of poor health and death, and the rapid rise of diet-related chronic diseases is putting an immense strain on health systems and the wider society. Yet nutrition care is not equitably integrated within our health systems. Strong government coordination on nutrition is often lacking. The number and distribution of trained nutrition professionals is not equitable. Globally, the median number stands at only 2.3 professionals per 100,000 people. Nutrition actions only represent a minuscule portion of national health budgets, although they can be highly cost-effective or even cost-saving solutions in the long term. And there is a lack of national surveys comprehensively and routinely assessing diets and the nutritional status of populations. To improve diets, save lives, and cut healthcare costs, nutrition should be mainstreamed in health systems. How do we do that? Fully integrate nutrition care into national health sector plans. Invest in human resources to increase the number of qualified nutrition professionals. Develop and align costly nutrition care plans with healthcare financing plans, scaled up and sustained to cover all forms of malnutrition. Include nutrition-related health products like therapeutic foods and innovative technological solutions like digital nutrition counseling. Scale up nutrition services to prevent the root causes of ill health, including poor diets and physical inactivity. Optimize health records and checks for nutrition care and to identify those in greatest need. Integrate nutrition in public health surveillance systems to strengthen the evidence base and inform targeted priority setting. Transforming our health systems to fully integrate nutrition is not easy, but it's an essential investment if we want to save lives and release the burden on our health systems and wider society. Nutritional well-being for all takes on a new urgency, given the potential for a well-nourished population to better confront chronic diseases, pandemics, and global shocks. This is not going to be the last pandemic, and we need resilient populations. The report makes the case for governments, businesses, and civil society to enable faster, more equitable progress towards ending malnutrition in 4 key ways. Build equitable, resilient, and sustainable food and health systems to ensure that everyone has access to healthy, affordable food and quality nutrition care. Expand financing, crucially for diet-related chronic diseases, and direct resources and programs to the communities and populations most affected. Focus on joint efforts by engaging and mobilizing all sectors to act now and target those most in need. Leverage key moments to renew and expand commitments and strengthen accountability to monitor pledges and commitments. The COVID-19 pandemic has changed the world around us and has also made clear that food and nutrition are now more important than ever. 2020 must represent a turning point for nutrition. As governments, businesses, and civil society increasingly recognize the depth and breadth of the global nutrition crisis, they are compelled to act. Investing in nutrition, expanding commitments, and strengthening accountability has now become urgent if we want to prepare our food systems and health systems for imminent shocks and preserve our future. Thank you very much, and I will now hand over to Lord Collins.
Thank you very much, Renata, for that excellent introduction to the report. Now we now move on to our keynote speakers, and we have two, and our first one is Dr. David Nabarro, Special Envoy to the WHO Director on COVID-19. We also have Wendy Morton, the Minister, and she will be joining us at some time, hopefully immediately following David's presentation. But I'll move straight on to Dr. David Nabarro.
Thanks very much indeed, Lord Collins, and thank you also to Renata Misha, not only for a great presentation, but also for a fabulous global nutrition report. I think it's such an important innovation as a key to global accountability on nutrition. And I've very much enjoyed the work that's been done this year. Colleagues, I'm so pleased that there are, as far as I can see, 255 people participating in this really important event, because what you're showing is that you really believe that nutrition is an issue of global importance, both because it's key to the well-being of individuals, but it's also key to the development of societies. Nutrition is central. And so what I'm going to do is to focus on two things. One is where we are in the COVID pandemic. And secondly, what I think needs to be done in relation to nutrition, given that the pandemic is underway. So 2 parts, and I'm going to try to do about 4 minutes in each part. So this virus is quite new. We've known about it really for just over 6 months. It's a coronavirus. It's a really dangerous and unpleasant virus, and it's here to stay. It's not going to suddenly disappear. Actually, if we look around the world, the intensity of the pandemic is actually increasing at this time. The number of new cases per day is rising, and the virus is particularly entrenched now in Southeast Asia, including Indonesia, Bangladesh, India, Pakistan. It's also entrenched in parts of Latin America. It's also entrenched in several countries in the Middle East, and it's coming into Africa and affecting African nations. And so whilst in Europe in particular, there's a sense that the pandemic is perhaps being suppressed, it's certainly not diminishing around the world. And there is a real need, I think, for all of us to understand that the pandemic is going to change our way of life. We are going to have to learn to function at greater distance from each other. We are going to learn to have to practice respiratory etiquette and protect ourselves when we cough. We are going to learn that we must not socialize when we're feeling unwell with COVID symptoms. We will have to wear face protection in a lot of public settings, particularly in places where people are crowded together. And as we look in more detail, we see that actually COVID is becoming a disease of poverty and a disease of deprivation. Where is it in India at the time? Now, it's in densely populated urban settings, in Mumbai, in Ahmedabad, in New Delhi, in Kolkata, and in Chennai. And then it's moving from these urban settings into rural areas, but it's basically most pronounced in urban communities. It's in migrant labor camps in various Middle Eastern countries. It's among poor people in occupations where they can't easily negotiate better working conditions in Europe and North America. And so COVID is a disease of inequity. But hang on, you're saying, isn't that malnutrition you're talking about? No, I'm saying COVID is a disease of inequity, but I'm also saying malnutrition is also a challenge due to inequity. And indeed, the Global Nutrition Report makes it absolutely clear that children are more likely to be malnourished if they come from poor households. Women are more likely to have low birth weight infants if they're poor, or more likely to be anemic if they are poor as well. And so we have here two conditions that are associated with inequity. And what we're also seeing as we look around the world is that COVID is actually increasing levels of poverty, levels of hunger, and we believe levels of malnutrition. So these two inequity challenges are actually coming together, and one is exacerbating the other. Of course, we don't have the figures. People say to me, how can you prove it? I say, actually, I don't need to prove it. I know that there are increasing numbers of poor households that, because of the virus and because of the containment efforts that have to be put in place, these poor households are experiencing increased hunger. They can't access nutritious food. Their children are becoming more malnourished. And this is happening. Please, let's not wait till we get the numbers to confirm it. Let's just recognize that this is what's happening. Just talk to people from any community-based organization, and they'll tell you COVID is increasing levels of hunger. It's pulling children out of school, and they're getting malnourished because they're not getting their school meals. It's making it harder for parents to be able to buy nutritious food and feed it to their children. So what's to be done? Number one, remind everybody all the time that COVID is affecting poor people really badly. Remind everybody that COVID is making people hungry and that we must pay attention to it. In particular, remind them that it's malnutrition that is the biggest threat from COVID, beyond hunger, because people cannot access nutritious food. The whole market for nutritious food in many parts of the world is actually broken. So we must promote nutrition as part of COVID response. We must absolutely prioritize it. Otherwise, there's going to be a whole generation that's experiencing poor nutrition now that's going to go on and be handicapped for long periods of their lives, especially because I think COVID is going to go on for quite a long time. But there's more. Remember that farmers and food system workers are actually finding it very hard to make ends meet and are suffering. And recognize that civil society organizations, the ones on whom we depend so much for the well-being of poor people, are really tight and short of resources. Just talk to people working for Oxfam, and we've got to Save Their Children. I'm sure we're here for them. And then lastly, and it's great that we've got people from the Sun Business Network on this call, please do everything possible to prioritize viable food supply and to make food supply systems more robust, but at all the time putting child nutrition, women's nutrition at the center. Because unless we do that, it gets forgotten. And if it gets forgotten, we will be really upset with ourselves in 10 years' time when we see just how much malnutrition has been caused as a result of the COVID pandemic. Thank you very much indeed, sir.
Thank you. Thank you very much. We've now been joined by the Minister, Wendy Morton, who was appointed Parliamentary Under-Secretary of State in the FCO and DFID in February of this year. She's been covering both departments, so she won't be too unsettled by the merger, but we'll hear about that later on. So I want to move straight to Wendy for her contribution to the webinar. Minister.
Thank you, Lord Collins, and thank you for inviting me to speak at this really important event, highlighting the findings of the 2020 Global Nutrition Report. This year's report sends a clear and a stark message, and that is progress towards global nutrition targets is too slow. The poorest countries are most affected by undernutrition, and vulnerable groups are most severely affected. And it's the most fragile countries in the world that are also most likely to be dealing with multiple types of malnutrition, placing enormous stress on the health and resilience of those affected. And with COVID-19 set to increase the risk of malnutrition among the poorest people around the world, this is a message that must be acted upon. We know that poor nutrition costs lives, contributing to 45% of child deaths and 20% of maternal deaths. It also undermines economic growth. Countries with a high burden of malnutrition lose on average 10% of GDP year on year due to lost productivity. Preventing and treating malnutrition is fundamental for ending the preventable deaths of mothers, newborns and children, a priority for the UK government. But tackling malnutrition will also bring wider benefits. Children who are protected from malnutrition go on to do better at school and to be healthier, more resilient and more productive adults. Since 2015, DFID has reached just over 50 million women, adolescent girls and young children with nutrition services in 25 countries. This includes treatment for child wasting, provision of essential supplements for pregnant women, support for safe infant and young child feeding, as well as investments in areas such as social protection. This support has delivered tangible results on the ground. So, for example, in Nigeria, the DFID-supported Child Development Grant Programme achieved reductions in child stunting and improved exclusive breastfeeding and dietary diversity. We've also supported many of the 61 governments in the Scaling Up Nutrition movement to design, fund and implement their own nutrition policies and programmes. For example, we enabled the government of Somalia to develop its first ever nutrition strategy. And this is an important step to equip governments to lead their own efforts to address malnutrition. But as the Global Nutrition Report highlights, there is still more to be done. And indeed, the challenge is increasing in the face of COVID-19. So what needs to be done to keep nutrition on the agenda? Well, firstly, nutrition must be properly integrated into the response to COVID-19, both in the immediate term and to support a resilient recovery. This means maintaining the delivery of life-saving nutrition services to prevent and treat malnutrition as part of broader investments in health. It means properly monitoring the impact of measures to contain COVID-19 on people's nutrition. As the Global Nutrition Report highlights, gaps in data make it extremely difficult to target support and to know whether what we are doing is working. And making sure people, particularly women and children, are able to access nutritious foods. This includes maintaining social protection programmes to protect the most vulnerable, but also providing support to those actors who help produce, transport and sell the diverse range of foods needed for good health. Equipping governments with clear guidance on how to ensure malnutrition is addressed effectively in the face of COVID-19. This is a challenging time for us all, and so relevant, timely advice that can be acted upon is key. Ensuring investments to build back greener set countries on a path to transform how food is produced, transported, sold and consumed, so that food systems work for people's health and are better for the planet. And so far to date, the UK has pledged £764 million to help end the COVID-19 pandemic. Prevention and treatment of malnutrition is an important part of this response, particularly in countries such as Somalia and Yemen, where malnutrition is already high and sadly expected to escalate further. Secondly, it's important that a new date is set for the Tokyo Nutrition for Growth Summit, and that actors step up to take action on this critical issue. Securing new commitments to nutrition is more important than ever, including to help lessen the damaging impact of COVID-19 on people's lives and livelihoods. An increased level investment in nutrition will be an important target for this summit, but its governments, businesses, the UN and civil society will need to go still further to catalyse the much needed shifts in food and health systems so that these deliver better nutrition for all. It will be particularly important to give focus at the Tokyo Summit to the priorities of the most vulnerable regions of the world, countries that have been repeatedly affected by conflict and climate-related shocks, even before the COVID-19 pandemic. These are now at high risk of being left even further behind. And finally, I'd encourage the Global Nutrition Report and all its supporters to keep getting the message out and to ensure that those who make commitments to nutrition take action. There are enormous and wide-ranging benefits that come from averting malnutrition. Investing in nutrition makes sense for people, the planet, and prosperity. But we must make the most of this important opportunity and ensure that every commitment secured translates to real benefits for the poorest and most vulnerable people of the world. Thank you.
Thank you very much, Minister, for your contribution this afternoon. I know you're very busy. If you can stay for a little bit and listen to our panel, that would be great. But I know that you've got to get off to other meetings. I'm now going to turn to the panel and to questions. And I know Dr. Navarro will also be staying, but I want to address the questions. We've had a huge wide range of questions to each of the three individual panel members first, and then maybe open it up more generally. My first question is to Catherine Richards, Head of Hunger and Nutrition at Save the Children UK. And that question is from Paul Noonan, Director of SD2 Hub. What does a pro-equity agenda mean for Save the Children's nutrition programming, and what lessons can be learned here?
Thank you, Lord Collins, and thank you very much for the opportunity to answer such an important question and to participate with you all here today. So at Save the Children, we recognise the Leave No One Behind pledge that's fundamental to the SDGs as a commitment to progress with equity. That commitment is something that we fought for. It's at the heart of the SDG framework. It's at the heart of the Global Nutrition Report this year. And it's a commitment to reach the furthest behind first and ensure that the targets are met for all segments of society. And quite simply, we've heard the challenges that we're facing in the world around nutrition right now, starker than ever because of COVID-19, but we simply have to progress this journey, focusing in on ensuring that we do reach the furthest behind first and we progress that agenda. The Global Nutrition Report confirms that failure to narrow the gaps between the most marginalised children and the rest of society, they're having a break on progress. But at Save the Children, we really see a pro-equity agenda as our agenda. We fight for children every single day because we believe that every child should be able to make their mark on the world. They should be able to build a better future with us all, for us all, and we'll do whatever it takes to ensure that children survive, get protection when they're in danger and have the chance to learn. And critically, we recognise malnutrition as one of the most important indicators for national progress on inequality. It provides us insight into how much support children receive in their early years. So for our programming, that means that we deliver direct nutrition interventions, as well as addressing social disparities through our nutrition sensitive programming, such as innovations that we've heard through the UN Secretary General's brief most recently, the importance of social protection, for example. It also means addressing interrelated indicators on child development, such as child marriage, birth registration and education, all these things that are interlinked when we're talking about inequalities. I would also point people to, we have a child inequality tracker, which we use to understand inequalities that persist against different indicators. So I would say that a pro-equity agenda is our agenda. But I would highlight that in order to drive equity, we have to have financing for it. So I just want to take 1 second to just highlight one particular point for the UK government as we look at nutrition moving forward. It's really, really important that people recognise that COVID-19 has only underscored the importance of not cutting back on sound investments in nutrition. Good nutrition saves lives. It's very, very clear. And it's concerning that the 2018 figures on DFID's nutrition financing were down. We really hope it's just a blip, because we know the UK government is very committed to nutrition. But it's really important to stress that if nutrition financing isn't sustained, then other development aims and investments and this pro-equity agenda simply won't be fulfilled. So furthermore, with nutrition for growth on the horizon, it's just so vital that the UK government sustains those levels of financing that it's so brilliantly committed to ensure that impact and progress is driven towards the nutrition targets, and that we really do achieve this pro-equity agenda, and we really do leave no one behind as we strive forward.
Thank you very much, Catherine, for that comprehensive response. I'm now going to move on to a question from Martin Short, CEO of the Power of Nutrition. And this question is to Foco Vientes. So take it away, please.
And you mean that's the question why in this?
Oh, I haven't asked you the question, have I? I'm going to say, I apologize for that. What we know that donor aid plays a massive role in funding nutrition, with both domestic and donor finances coming under huge strain from COVID. How do you see the private sector supporting nutrition interventions at scale, especially in the next 18 months? And that's, of course, from Martin Short.
Yeah, thank you. Thank you for the question. And thank
Sorry
you for having us here tonight. Indeed, we see lower funding. By the way, that's, of course, already going on for a while. Now, we might even have a bigger challenge on our hands. But the fact that public funding has been under stress has been already something that's been going on for a while. And I think what's important is the Global Nutrition Report, as David already mentioned, we now have the global accountability. I would also say we have majority of the science, and what we do need is more action. We already started a lot of action, sun movement, etc. So a lot of things are happening. How do we take this now further? Now, if you look at the Global Nutrition Report, and I take a little bit of a detour before I come to the answer of the question. One of the things is nutrition is a scientific topic, but in the end, nutrition is a consumer topic. And we cannot force the consumer, we can't dictate what the consumer is consuming. Unfortunately, we have to convince the consumer to consume. And that is one of the things, if you look at the Global Nutrition Report for the 2021 version, there will be more focus on the consumer, because that is part of the challenge. Now, why do I come to that answer? The private sector can invest in and is investing. We invested $50 million in a facility doing fortified foods, making affordable nutrition available in Rwanda. And we are now planning between 1 and 2 billion investment in the coming 10 years in nutrition, together with public and private partners. So we strongly believe that there is a case, but we need the consumer, that is one, and we need to have an innovative approach towards leveraging the public money that is available, blending and using the public funds to leverage, like for instance, what the Power of Nutrition is doing, is the way forward. How can we make public money work harder? So if there's less available, we need to get more out of that. And we see that it is possible. It's also possible if you see that we spend now, to take an example, 29 billion on aid for Africa. If we would turn aid into investments, if we would take some of the aid money and turn it into investments, we not only give people fish, but we teach how to fish, and we come to much more sustainable solutions. So we see in the coming period a heavy focus on bringing public and private agendas much closer together. It was not that at University Gate all the good people went into public sector and into civil society and all the bad people went into business. There is a big drive in the business community to make sure that in the coming period we get the societies through this very difficult period. There is the willingness to invest. Let's bring these together in a much more innovative way than we've done so far, and then get going and spend in nutrition. Private sector needs sustainable business models, and that's why that consumer bit comes in. If we create the right demand, the investments by the private sector will follow automatically.
Thank you very much for that response. And of course, I should have said even in my introduction, this is not only about governments and the private sector, it's also about the whole range of civil society taking this agenda on board. Now, I want to now move to Minister Okada, who's the Deputy Deputy Head of the mission at the Embassy of Japan, who of course hosting the G4 Summit, the Nutrition for Growth Summit, later on, would have been taking place later on in the year. Now, I'm taking a bit of a liberty here because my question comes from fellow officers of the APPG, and it is that a key development priority for Japan is global health, in particular expanding universal health coverage. How is Japan planning to integrate nutrition into UHC roadmaps?
Okay, thank you, Lord Collins, and thank you very much for giving me this opportunity to participate in this very important event. First of all, being a strong believer in the importance of nutrition in the universal health coverage, Japan has been pushing for the integration of nutrition into UHC in global discussion. We have been trying to give it a salience in this discussion. And one example is the UHC political declaration at the Universal Health Coverage high-level meeting at the United Nations General Assembly last year. So we would continue to do this, leading to the summit in Japan, which unfortunately will not be held in December this year. We are discussing this, what is the best path forward to host this summit, because needlessly to say, the summit is an opportunity to mobilize the global partnership towards this very important goal. And we hope that we hope to work towards securing new and substantial financial and policy commitments at this opportunity at the summit. Internally, there has been a discussion going on, and the advisory group meeting in April, which was virtually held, there was, I think, the feeling that this summit needs to be postponed. And so we hope that we will be able to share more details when and how it will be hosted. But I just want to assure you that we will do everything we can to make it a successful meeting. The other thing is that Japan has long history of the putting this nutrition question in the center of our health system. For example, government has been training expert dietitians and placing them in local governments, schools, hospitals, and care homes. And National Health and Nutrition Survey has been annually conducted for more than 70 years. So we would like to share those experiences together with our struggles, successes, and failures. And they would like to stimulate the discussion on how this mainstreaming of the nutrition in the universal health coverage can be achieved. Thank you very much.
Thank you very much, Minister. I now want to turn to Dr. Nabarro again, and this is a question from Rachel Thompson, the World Obesity Federation, which actually very much links into your introductory keynote speech. The question is that we know, as the GNR report outlines, that a pro-nutrition equity policy agenda positively impacts the root causes of nutrition inequalities. What do you believe is necessary for governments to work in a health in all policies approach to tackle this problem?
Thanks very much indeed. People must come first. They must receive all possible support in the places where they live. And if we possibly can, we need to actually focus particularly on those who are the poorest, the most deprived, who've got the least power, because we know that theirs are going to be the greatest challenges when it comes to improving nutrition. So people, place, and pro-poor policies would be my 3 recommendations. I actually think, just one step more, that many governments do actually find it hard to successfully implement pro-poor policies unless they have really committed to do so to their electorates and also to parliamentarians. It's quite easy to have a policy which is designed for everybody, but something that's pro-poor is particularly designed for people who are poor, and basically it's resources that are ring-fenced to stop capture by those who are better off. In nutrition, this is really important. I mean, food is precious, cash is precious. So actually ring-fencing and protecting the various services for people who are poor is not always easy to do. It doesn't necessarily make you super popular with the wealthier parts of your electorate, but it is absolutely essential. And it must be done in the places where people live, rather than just simply done where it's convenient for the service provider. Because quite often, people who are poor have all sorts of barriers of coming away and coming to places to get services that are away from where they live. They get stopped and harassed and so on. So focusing on people pretty much with a pro-poor approach and very much focused on the place where people live, that's what I would be asking for. And by the way, I'm delighted to hear that the question comes from the Obesity Federation, because this is a time more than any when we need to recognize that there is malnutrition at both ends of the spectrum, because when it comes to COVID, as I think everybody knows, being obese is not a cool thing to be. So let's recognize that we've got to work on both ends of the malnutrition spectrum. They're both associated with poverty and equity, and they're both dangerous for people for lots of reasons. Thanks a lot.
Thank you very much for that response. I'm going to squeeze in one more round of questions. We're running out of time a bit, but my second question round goes first to Catherine Richards, and it's on an issue close to my heart in terms of how can civil society leverage the 2020 GNR recommendations to advocate for stronger government commitments to the next N4 G summit?
Thank you for another great question. I'm conscious we're short of time, so I'll keep it quite tight. I think the first thing I would point to is civil society and all actors really need to utilise the brilliant work that's gone into the Nutrition for Growth commitment making guide that the government of Japan has led the development of. Its advisory group, which I'm really proud to be a member of, along with many other brilliant colleagues, have contributed to the development of that guide, and it gives really clear guidance on how priorities and commitments can be made that further our shared nutrition agenda. So it includes guidance on how we can take forward. So it reflects the GNR recommendations around the integration of nutrition into universal health coverage, transforming the food system, and addressing malnutrition in fragile and conflict-affected contexts. So the first point would be to use that. The second would be to really engage communities. And for all of us, that means we have to recognise, value and protect civil society space. Civil society by its very nature is closest to communities. We can reach and engage with others that other sectors simply can't. So civil society has to do that. We have to engage communities, talk to them about nutrition, have those dialogues, but also offer platforms and invite them to speak. Youth and young people are central to that as well. The Scaling Up Nutrition movement and the Some Civil Society Network is a brilliant, brilliant network that reaches and supports over 3,000 national and local community and national civil society organisations. It's also got a brilliant youth network who are there and passionate and ready to engage in this fight with all of us. So let's give them as many platforms as possible, engage our young people, engage our communities, and take the fight forward together.
Certainly in my recent visits to Kenya and Zambia, it was civil society there that I felt most impressed with, and how they were actually going to make these policies more sustainable. My second round of question goes to Foko. As the GNR stresses, poor diets are not simply a matter of personal food choices. Given that the food industry is accountable for producing and marketing healthier food products, what are the key actions the industry is taking to ensure this? And this is from the GNR co-chairs.
Good, very good question. And I would say it's not only the private sector, this is typically also an area of collaboration. For me, 3 items. 1, the consumer. I mentioned it before. We need to work on the fact that this becomes an aspirational topic for consumers. So that's, I think, a very important thing that we need to do. And that's not something that the private sector can do alone. That's typically where governments, civil society and private sector need to come together to what I would call to do choice influencing. So that's an important part to work on the consumer. Second is carrot and sticks. Let's make sure that right now calories are cheap. Let's make sure that nutritious food become cheap, affordable. So the second, so we were talking about aspiration is 1, affordability is number 2. So let's work on carrot and sticks, disincentivize the unhealthy, incentivize the healthy. And then thirdly, what I would say is really is that collaboration part. And what I said is, if you look at choice influencing, let's work together. What can we do? What can the government do? What can civil society do? What can the private sector do together? Choice editing, take things, if they're really bad, take them off the shelf. That's a second solution. And the third solution, and that's really the private sector, is innovation. There are all sorts of solutions. We, as DSM, the company that I work for, we're looking into low sodium solution, low calorie solutions to make sure that what people consume is also a better quality food than what they would otherwise consume.
Thank you very much. I think I've got time for one more question to Minister Okada. And it's this one: strengthening nutritional accountability is crucial. What are Japan's calls to action for governments, businesses, and civil society to achieve this?
Okay. Thank you, Lord Collins. Yes, the accountability is crucial to make the best use of limited resources and to secure further resources. And on one hand, the we are urging stakeholders to make SMART commitments. And the SMART stands for specific, measurable, achievable, achievable, and the relevant and time bound. So if the commitment is SMART, we can measure how much is being achieved. And there is another discussion going on among the stakeholders in preparation for the summit, and that is to form a nutrition accountability framework led by the Global Nutrition Report and others. Together with the SMART commitments and this improved nutrition accountability framework, I think we can really make great progress towards improving the accountability. Thank you very much.
Thank you. Well, we're dead on 5, which is our end time. So without further ado, I just want to thank our 2 keynote speakers, excellent contributions. I certainly want to thank our panelists who've been able to respond to the questions. I know there's been a fantastic amount of questions coming through on the Q&A box. I'm sorry we may not have addressed all of your issues, but I think we've done a fair good job in covering most. And I'd like to thank you, the audience, for participating. And certainly, I think there are some key lessons that we can all take away from this. And for me, it's the most important thing about the inequalities in our world that drive so much of this. And how do we address it, and how do we make sure the solutions are sustainable? One thing that struck me from the report is, of course, not only the inequalities between countries, but also the huge inequalities that still exist within countries. And I certainly think Dr. Nabarro has given us a very clear agenda to address those issues. So without further ado, I would encourage everyone to visit the GNR website, download the report, and engage with the GNR on social media. And you can follow me at Lord Collins, Lord_Collins on Twitter, and any comments I will see on Twitter. So thank you so much for participating. I now bring the webinar to an end. Thank you.
Thanks very much, everybody. Bye-bye.
Bye-bye. Thank you.
Bye-bye. Thank you all.